All right. Well, good afternoon, everyone. Welcome to the January 2025 OMHSAS Stakeholder webinar. This is Deputy Secretary Jen Smith, and we've got a pretty full agenda for you today, so we're going to go ahead and get started. Really quickly, some housekeeping items. If you are a participant, you are muted and in listen-only mode. So the opportunity that you have to ask questions is by clicking on the little button. It should be up in the right-hand corner of your screen that has a little question mark in it. If you click on that box, a window pane should open up that you can type your questions in. In addition to that opportunity to ask questions right now, real time, we also have a resource account there displayed on the screen for you, which is RA-OMHSAS correspond at pa.gov. And you can submit questions there, or you can submit suggestions for agenda topics. So getting started here on the agenda, I wanted to just cover some updates around the state budget, since we're getting really close to that before we move into the next items. So for those who are less familiar with the state budget process, next week on Tuesday, February 4th, Governor Shapiro will be delivering his budget address. I don't have the specific time, although historically it's sometime between 11 and noon that he starts making his remarks. And this will be the governor's proposal to the General Assembly for what he believes our state fiscal year 25-26 budget should look like. After the completion of his budget address, that will kick off a number of conversations amongst members of the General Assembly in trying to pull together what they will ultimately propose to be the state budget. And the goal is to have an approved state budget by both the House and the Senate, as well as the governor, by July 1. So please do tune in on Tuesday to the governor's address. Usually is recorded and available after the fact if you can't watch real time. In addition to the governor's budget address, also happening next week on Friday, February 7th, will be Secretary Arkush's stakeholder budget address. So she'll do a little slide presentation detailing what from the governor's budget specifically supports the Department of Human Services. And similar to the governor's budget address, that presentation will also be recorded and be available after the fact. As soon as we have the details for that meeting in terms of a time and a link to connect, we will make sure to push that out through our stakeholder communications. So stay tuned for that. And again, that's Friday, February 7th, so a week from tomorrow. Okay, moving into our other agenda items for today, wanted to provide a brief update on the Behavioral Health Council. If you recall, this was a council established under a governor's executive order that was designed to review and assess gaps in the behavioral health system and provide some recommendations to help close those gaps and overcome barriers and challenges. That group began meeting in December of 2023, meets on a monthly basis. Topics that we've been covering or are looking to cover here in the early part of 2025 include a deep dive into screening and assessment processes and ways in which we could perhaps standardize or streamline those. We'll be spending a couple sessions on the connectivity between criminal justice and the behavioral health system, and then a focus on older adults a little bit later in the spring. So we're continuing to work towards refining some recommendations. As you can imagine, our behavioral health system is pretty complex and there's a lot of moving pieces. So it is taking a little bit longer than originally expected to develop a report with those recommendations, but really making good progress, having some good discussions amongst that council as well as the advisory committee, which probably some of you tuning in are a part of. So continued movement there, but no definitive date for an issuance of that report of recommendations. Next, wanted to provide a quick update for you on the 1115 Keystones of Health waiver. So if you recall, this is a waiver that Secretary Arkush was really, really passionate about submitting, and it's addressing some health-related social needs. So there were 4 key components to that particular waiver application that was submitted. It was continuous eligibility for children under 6. Then there was a reentry component for individuals with behavioral health conditions, amongst perhaps other conditions. There was a piece around food and nutrition, and then a component around housing. We had submitted that application to CMS and were anxiously awaiting their approval to be able to move forward. We successfully received that approval at the end of December, so just about a month ago. What happens next is that we still need to work very closely with the General Assembly to ensure that they are supportive of what's moving forward and can help appropriate funds to address any of the costs that are necessary to implement and administer that waiver. So we're still kind of in the planning process. I'm certain you will hear lots about this probably during our budget hearings. So stay tuned for that. But I wanted to share the good news that we've kind of gotten one step closer in the process and we have received official CMS approval. So that's a really good step forward. All right, next I am going to turn the microphone over to Scott Talley, and he's going to provide an update for you on our PRTF regulations. Scott?
Thanks, Jen. Good afternoon, everybody. So the PRTF regs, the Psychiatric Residential Treatment Facility regs, have gone through the comment period that ended in December. So at this point, we are in the process of organizing the comments. We're doing it by area and reg, the number of comments we have for individual regs. And we're also reviewing, we've got several providers, which we appreciate, who have given us some potential solutions to areas they're not sure they can comply with. So we've taken a look at that. We've actually made a few changes related to that. Our next step, though, is going to be, we're going to be holding some webinars, and we're going to be holding webinars for providers, for family, for youth, for behavioral health managed care organizations, primary contractors, and counties separately, not all together. And we're going to do that to do a listening session. We will provide some of the changes that we have made, but mostly we want to listen and maybe hear where there's a struggle to be able to meet the regulations and see if there's some compromise we can make there. I don't want to compromise care, but if we can figure out some things that would be good. But please note that one of the reasons why we're doing the regulations is to come into compliance with the federal 42 CFR regulations. So we cannot waive those. So those are things that we can also let you know that the reason why we have them in the regs is to come into compliance with the federal regulations. So after we do that, then we will update the regulations and make any changes, and then it will go back through a review process within DHS, and then our next step after that will be to do it with the Independent Regulatory Review Commission, IRC, to set up a hearing. So that'll go over several months to a year, maybe a little bit longer than that, but we'll keep people up to date, and we'll let people know when we're going to do the webinars, listening sessions, and try to get as much feedback as we can, and we will definitely take into consideration any feedback that we get. So that's what I have for you today. Jen?
Thanks,
Oh no,
Scott.
I go to Jill, I think.
Oh, it's okay. Thanks. Appreciate your update. I'm going to quickly, before I turn it to Jill, just answer a couple of questions that were posed there. Andrew asked if the governor's budget proposal is expected to include enhanced Medicaid funding to support the 1115 waiver and capitation funding. You will have to wait and see, Andrew. The governor, you will hear that directly from the governor's mouth on Tuesday. And then I'm sure that Secretary Arkush would cover if there's any funding related to enhanced DHS related activities. She'll happily share that during her address. I know there was another related question around when information about her budget briefing will be shared. As I stated, I don't have it right now, so I'm sure that it will be forthcoming. I don't know if it'll go out this week or very early next week, but as soon as we have it, that will be shared. I also saw a couple of questions slash comments around minutes for the Behavioral Health Council. So what is publicly available is out on the website. I will certainly take the feedback that's provided here in terms of helpfulness of those minutes and share that with the executive director. Okay, Jill, you had our next agenda item. We're sticking with that theme about regulation updates. Would you like to share a little bit about our psychiatric rehabilitation regs?
Absolutely. Good afternoon, everyone. We are very excited to be announcing that our psychiatric rehabilitation regs were published in the Pennsylvania Bulletin on January 18th, and they were effective on that date. And the link is on the slide. We can also put it in the chat for folks while we're talking if you need to see it. At this time, the only place to see that new language is in the Pennsylvania Bulletin. The Title 55 page, the code where you go to look at our regs on a regular basis, is updated quarterly. And in its next quarterly update, that new language for psychiatric rehabilitation regulations should be there. And then you'll be able to see it all in one place. We're anticipating that will either be in April or May. So we will let you know when it's available in Title 55, but it is currently not on that page. You have to see it in the PA Bulletin. There were several providers already providing services to youth in PRS under a waiver, and our operations team has reached out to them directly and worked through that transition. So we are hopeful that there will not be any significant disruption to services, but if there are any issues, of course, reach out to your field office and have that conversation. And OMHSAS policy has gathered a number of questions from the stakeholder overviews we did on the psych rehab regulation changes. We are working on developing an FAQ document to further aid in implementation. That will be going into DHS exec review in the next 2 weeks or so, and then we will get it out to the field when it's ready. Other regs of interest to folks, our crisis regs are continued to be under review. They're currently in our governor's office. That is the next to last step. If you are familiar with the regulation process, they will go to the Attorney General and then they will go out for public comment. But the Attorney General can take more time than the 30 days they are initially allotted. So we don't have a great ETA on those yet. We'll know after we know how long the Attorney General's office will need to review them. The 5100 HIPAA privacy regulations are also under review in DHS, and we hope those will be moving forward in the near future. You can go to my next slide then, Mary. I also have for you today an update on telehealth and specifically our four-wall solution that we have discussed on previous meetings here. But for folks who are not familiar, just to quickly recap, the federal final rule that was released in November gave states the option to apply for an exception to the four walls rule for their behavioral health clinics, along with clinics located in rural areas of their state. So OMAP and OMHSAS have been working jointly together. We have developed a state plan amendment that is currently under departmental review. That is intended to cover all of the psychiatric clinics in Pennsylvania, so outpatient psych, along with all of our drug and alcohol clinics. And then OMAP is also looking to cover family planning clinics and independent medical clinics in rural areas of the state. finalizing that language through the DHS exec review process, and then we intend to have that submitted to CMS in the first quarter of 2025 so that those changes can be retroactive to 1/1/25. We also need to do some work on the state level to effectuate that change, though. Some of our regulations contradict the ability to do services outside of the four walls. So we are working with the House, hoping that we can abrogate some of those sections of our regulations through statute, since that is a much faster process than our regulatory process. And then the final piece that we're working on around the firewall solution is we are proactively drafting a bulletin to provide guidance to the field. Assuming we get parts 1 and 2 of this done, then we will release that bulletin so all of you have information about how to actually implement it in the services you're delivering or overseeing. And that's all I have, Jen.
Thanks, Jill. I saw a question come in around whether FQHCs fall under the four walls rule.
FQHCs do not fall under the four walls rule. So they will not be a part of this SPA, but they don't need to be a part of this SPA because they're also not, their hands are not tied by the four walls rule currently.
Great, thanks for clarifying that. I think, Jill, that you covered this a little bit, but there was a question posted in the chat regarding the PRS regs and whether there would be any guidance issued regarding the weekly note and CMS requirements.
Yes, so the FAQ that we are working on focuses heavily on that change from a daily to weekly note. We know folks have a lot of questions about that, and we are intending to answer that in the FAQ. Feel free to submit any other questions you have so we can make sure we get those answered for you.
Great. Okay, thank you, Jill. We're going to go ahead and move on. If others have questions, we'll be sure to either circle back to those or try to answer them directly in the GoToMeeting application. So at this point, I'm going to turn the floor over to Dan Trago, who's going to give a really informative update on 988. Dan?
Thank you, Jen. Hello, everybody. Next slide, please. So I want to give some quick background on 988. I'm fairly certain that most, if not all of this audience is quite familiar with 988, but just want to kind of hit some of the high points and, clarify some of the murkier points around it about how it's structured, how it came to be. So obviously it's a 3-digit number connecting individuals nationwide to crisis counselors. This was a bipartisan Senate bill that was signed in October of 2020, and then there was a subsequent FCC order that required carriers to route calls to the 988 number to crisis centers that were associated with the National Suicide Prevention Lifeline. So to that point, the number is new as of 2020-ish, went live 2022, but most of the call centers are not. So these were call centers who participated in the 1-800-273-TALK network that came about in 2005. So most of our 988 call centers and most nationwide have a wealth of experience with crisis calls and things of that nature. Next slide, please. So how it's set up, oversight for 988 at the federal level is by SAMHSA, which is obviously part of HHS. And then Vibrant Emotional Health is the national administrator for 988. So they did a lot of work with the 273 talk number, and they've continued on that role as a contractor of SAMHSA to administer. So in Pennsylvania, we have 988 coverage in all 67 counties. So wherever you are in Pennsylvania, you dial 988, you will be connected to a call center in Pennsylvania. There are 12 such call centers, and there's one call center that, in addition to providing voice coverage, also provides chat and text. We also have 2 that are currently onboarding. One should actually be just about any day now within the next several days, and probably the other by the end of February. So updates to come there soon, but we don't quite have a solid date yet. Something that I do find is sometimes a misconception in 988 is when we say we have 12 call centers, people assume that they're 12 kind of uniform clones of each other call centers, about the same size, same kind of staffing. But it's actually quite diverse in Pennsylvania. So we have a call center that covers over half of the counties, mostly kind of the western counties from Butler County, where they're headquartered, up over the northern tier, all the way down through Mifflin, Juniata, Huntington. And we have others that are solely the call center for their county. So, for instance, Resolve Crisis Services in Allegheny County, they serve only Allegheny County as primary coverage. So, um, similarly, most of the call centers are also crisis providers, providing mobile crisis or crisis walk-in. But again, those 12 centers look a little bit different from center to center in terms of what services they provide and how large of a catchment area there is. Um, Routing has been pretty static. We're actually looking at the map now to just kind of iron out a few kind of obscurities and glitches in the map that we have. But you know, the upside of having the 12 centers, soon to be 14, is that we are really nimble. We have some redundancies built in there. So when there are outages or there are staffing issues or any other sorts of issues, our call centers have done a really good job of covering the state. Next slide, please. So by the numbers, Pennsylvania is the 5th most populous state, but we receive the 6th highest volume of 988 calls. It's not by a lot. So what that volume ends up shaking out to be is about 10,000 calls per month. We've had over 11,000. So um, that number is also growing, as you'll see. 32% in voice modality, 188% since we started doing chats and text. So volume has increased rapidly. We've looked a little bit of data from the county crisis lines. There has been a little bit of a drop off in volume to the local lines, but certainly not one to one corresponding with the increase in calls and contacts to 988. In terms of how we're doing, we are exceeding federal call rate benchmarks since March of 2024. Our answer rate for the year in 2024 was 90.7. We're up typically over 91% now. And pat on the back to Pennsylvania in terms of those larger states that do receive 10,000 or more calls per month. Last I checked, we were the top in-state answer rate for those. Also important to note, 93% of calls, and this is Pennsylvania specific data that we've gotten from our own center and not national data, but 93% of calls result in resolution of the individual's crisis when they call in. So it's important to note because obviously there's an important place for mobile crisis stabilization in the crisis continuum. But it really does go to show that 988 and telephone crisis is a really powerful tool to resolve crises, generally low cost, low friction kind of way to do that. Next slide, please. So coming into 2025, we're in a pretty good place in terms of our metrics, our coverage. We have coverage across the state. Like I said, I would argue, and on pretty good basis, that we are leading nationally in a lot of those areas in 988. So with that in mind, there's always room for progress. So these 5 goals I'll kind of step through in terms of what we're looking to do in 2025. Next slide, please. So one thing that we really want to focus on is increasing integration with the crisis continuum. 988 was kind of a mandate from above from the feds. It came in very quickly. The implementation was very sudden. So there are definitely some areas where we could create better connections between county entities and providers and even the 988 call centers themselves. So importantly there, we are looking to hear from all stakeholders involved in that. So that would be the centers, the providers, the counties, law enforcement, other crisis partners, just to make sure that those processes are collaborative and that they work for everyone. And obviously 67 counties, 67 ways of doing things, as they like to say here. So those processes will also still need to be responsive to local needs. Similarly with mobile crisis dispatch, we're a little bit all over the map in terms of what happens when mobile crisis dispatch or mobile crisis is dispatched from a 988 call, in terms of what that connection looks like, what the process is, how information follows that person through the crisis continuum. So I really just want to work with our partners to make sure that those are consistent and that they're leading to the best outcomes for individuals in crisis. Next slide, please. Chat and text is a huge priority right now. So that modality has the same benchmarks at the federal level of 90% in-state answer rate, or higher. And unfortunately, we're currently not there right now. We have only one center of our 12 currently who are providing the chat and text modality. So we are working with our centers to see how we can facilitate them also kicking in, even if it's a shift or a day per week, just to cover some of that slack so that we're not relying on one provider. Obviously, that will serve to improve the in-state answer rate. Also, trying to staff up the existing provider that we do have for chat and text. Again, this was 188% growth since we started doing it versus 51% nationally. So I think we not only need to look at staffing up to meet that 90% benchmark now, but also keep a close eye on how the chat and text modality is growing versus the voice modality, and making sure that we're equipping the call centers to have the resources and to operationalize shifting staff to the to whatever modality has the demand at that time. It is challenging though. Chat and text interactions are about 3 times longer than voice interactions based on our data. So obviously time is money, and you need more FTEs to respond to that demand. Vibrant, as I mentioned, was the national administrator for 988. They do require that call centers providing chat and text coverage use their platform. So there are some barriers. One, just centers not being comfortable using that platform, but also ones that are affiliated with larger hospital systems, for example, where it's not necessarily easy to implement new IT overnight. And lastly, staff has to work one modality or the other for their shift. They're not allowed to switch back and forth, which, talking it through with Vibrant, really, it's because there's potentially a lot of kind of downtime or waiting for response time on the chat and text modality. So people historically have been getting into situations in other call centers nationally where, they're responding to a phone call and then they get a response on the chat and text side, and it's never good to try to be dealing with 2 crises at once. Next slide, please. 911 988 interoperability is another hot topic. It's a hot topic nationally. They are 2 different systems, 2 distinct systems, but they certainly are tied together in that crises never look the same. Sometimes there's a situation that has a public safety or imminent risk component where that law enforcement presence or EMS presence is needed. So we're looking at ways to try to get those systems to talk to each other a little better and facilitate handoff from one to the other, and help them collaborate. So we've been working closely with PEMA on that. We've been having monthly 988 911 subcommittee meetings to discuss what the issues are, what the barriers are, and what the concerns are from the county level public safety access points. And we'll be meeting with PEMA next month to discuss kind of next steps in terms of what we need to address through legislation, what we need to address through policy, what points both DHS and PEMA need to agree upon to move things forward in this space. Next slide, please. So this is always the topic for all of our services across the board in state government. Funding is always a top ticket item. In 988, it is particularly important because as of right now, the past few years since 988 launch, we've been funded largely through federal grants. The last one that is currently active expires in September of 2026. So we haven't gotten any indications either way yet whether the federal government plans to continue to fund 988. But we certainly are working on some contingency plans either way. There's also a small bit of one-time state funding, but again, there's not a line item or consistent stream of funding that is tied to 988 currently. So we're looking at a couple different funding options. There's telecommunications surcharge, which is structured like the 911 fee. This is actually the funding method that is spelled out in the Senate bill that established 988 back in 2020. Unfortunately, there was no mandate for states to do that, so they kind of suggested it but didn't mandate it. So there's not really any force behind that recommendation. We've shopped that idea around before a couple years ago, and it didn't really get much traction. So we'll be investigating that again and hopefully getting better results this time. Alternately, if we get a line item for it, great. But again, it's always challenging to get funding. So just kind of going down through the cascade, even exploring voluntary funding, license plates, check boxes, something that's a little more palatable, cost neutral, just to see if there's any traction for that. And then obviously, worst case scenario, you can always try to get a little creative with existing funding streams, but that's always kind of a last resort. Next slide, please. So lastly, want to increase information and transparency around 988. 988 did come on fairly quickly. The implementation was also pretty quick. And this coming down from the federal government and then filtered through the states into the communities, there's certainly a lot of public awareness and just general knowledge about 988 that could be better. So wanted to look into different ways, especially with our providers, our community partners, our county administrators, to try to figure out the best way to get everybody on the same page with 988, to be clear and transparent about what we're doing at OMHSAS in the 988 space. So currently looking at those options now. We've discussed regular communications, potentially a public-facing dashboard, or just kind of enhancing the public information we already have out there on 988. But I invite you to provide any suggestions. That's why I left my email here. Certainly happy to hear any suggestions that could move these efforts forward, because it's, especially when the team at OMSAS that's been working on 988 from the beginning, the longer we're in it, the harder it is to kind of view it from that outside lens, that provider lens, that community lens. So again, I just invite anyone to provide any sort of feedback or recommendations on what we can do to make 988 work for everyone and to keep everybody in the loop. So that's all I have for today.
Thank you, Dan. Appreciate that comprehensive update. I saw there are two questions, Dan, I think that came in related to your part of the presentation. One was, can you explain, or do you know what happened to the behavioral health related calls that went into 911?
That is an excellent question, and we've had that discussion with Pima. They have some data on it, but the conclusion that we kind of reached collectively with them and with our 988 911 subcommittee is that the number that is available for those behavioral health calls is probably vastly underreported. So we kind of agreed that that's not really the number that we want to put forward. So that's part of our conversations with Pima, is how do we better capture what calls come into 988 that are really just truly behavioral health calls that should be addressed by a crisis counselor versus a dispatcher.
Great. Thanks, Dan. And then I saw one around whether or not there are any updates to Apricot.
Yes. So we unfortunately had just technical issue after technical issue with the Apricot platform. So the plan currently is to put the resources that are there somewhere that is not paywalled or behind a login or anything of the sort, right? To make it more accessible to where it's not going to trip so many of those, you know, IT security firewall issues. I think that was really the main one, right? Where a lot of provider and county firewalls just did not like that domain and would not let people proceed through it. So, yeah, it's probably going to end up being something like an unpublished web page, right? So it's like a link that we would send out that's not necessarily Googleable, but since all of these resources are public information and it's really just aggregated, it's probably fine not to put it behind any sort of login or domain like that. So stay tuned on that one. We're trying to figure out kind of where to put that data now.
Great. Thank you so much. That's all I see in terms of questions for you. So we'll keep moving ahead here. Next up, we have Jason Demanicore, and he's going to talk a little bit about a licensing update and some regulatory guidance. Jason?
Good afternoon, everyone. I'm happy to share some of the work that we've been doing related to licensing. Starting in, or I should say since November of last year, OMHSAS distributed 3 regulatory compliance guides, starting with a revised psychiatric outpatient clinic regulation guide, which was distributed November 14th, followed by the partial hospitalization RCG in December and the IBHS RCG in January. For those that might not be familiar, regulatory compliance guides are tools that providers, OMHSAS staff, the public, really anyone who has an interest or a stake in the licensing process to better understand the regulation. So they list out every part of the regulatory chapter and explains what it means and what we specifically look for to determine compliance when we're conducting our inspections. So the RCGs can be found on the mental health licensing website, and I'll put a link to that in the chat, and any questions or comments on any of the RCGs can be directed to the RA account that I'll also share. The last thing I wanted to talk about was OMHSAS Bulletin 24-04. This was titled Procedures for Waiver of OMHSAS Program Regs and Standards, and it was issued and became effective December 17th. And this updated and obsoleted the 2016 bulletin related to waivers. It updated language and the process to appeal a waiver determination, and we will provide the RA account if there are any questions related to that bulletin. That's all I have to share unless there are any questions.
Thank you, Jason. I'm just taking a look here. Andrew, if you look at the screen right now, you will see the RA account. I will pop it into a reply here in just a moment for you. We had a question, Jill, for you around the 4 walls issue, asking if the 4 walls is applicable to community mental health programs such as CRR and CDA settings.
The 4 walls rule is only applicable to services that are billed under our clinic section of the state plan. So it is those that I had on my slide, Mary, if you want to pull back up to that slide, my second one. On the behavioral health side, those are the only clinics in our state plan under the clinic section. So if you are not on that list of 440.90D, the 4 walls rule does not apply to you in behavioral health.
Thank you, Jill.
Of course.
Let's see what else we have coming in here. I saw a suggestion around 988. Thank you, David. We will make sure we pass that along. When do we expect the PRS frequently asked questions to be released, Jill?
Because it's not yet in DHS ERP, I would hesitate to give an exact date, but as noted, we're going to try to put that in DHS review in about 2 weeks. So hopefully this spring.
Great. When will OMHSAS be conducting licensing reviews based on the new PRS regulations?
This is Jason. The regulation has been officially implemented, so we'll conduct and continue to conduct technical assistance with providers. And until things really get clarified, we're going to be very flexible.
Thanks, Jason. And then I see one more here related to the four walls issue. And the question is asking whether providers should continue to provide services as they have been while we await the final change. And the answer to that is yes. That's the communication we've been giving related to this issue. Since the end of the public health emergency, there are providers all across the nation that really have been unable to meet the normal requirements of this four walls condition. And what we don't want to do is cut off services for individuals. So CMS has been really good about working with states and just encouraging progress to be made in this space, which we certainly have been doing. Now that there's sort of this option for an exception to the rule, that's really helpful for everybody, and we continue to make progress in that respect. So no, we would not expect you to eliminate any services or cut services for individuals who are receiving them now. Okay. We have a budget question from Tammy. When will the OMHSAS allocation letters for 24-25 be distributed? Dawn, do I have you on the phone? I don't hear her, so we might have to get back to you, Tammy. If you could pop your email address in there, we'll make sure to respond directly to you. Is the resource account that we provided to be used for PRS regulation questions? Jill, I'll let you answer that. Is there a specific resource account you want for PRS related questions?
Yes, they should go to RA-PW psych rehab at pa.gov, and I will put that in the chat for folks.
Okay. Great, Tammy, I saw your email there. We'll make sure we get that information to you. And I believe we have addressed all of the questions. Oh, one more coming in here. When will the Crisis Response Center award letters be sent? Jill, these are the ones I believe that we just recently announced.
Yes, we are working on that. If you're an administrator who was awarded those funds, we'd be happy to have a conversation with you about that. But the short answer is because that includes a new funding stream for our office in state dollars that we need to set terms and conditions for. We need to work through a little bit of language with our legal team before we can put out the formal award letters. But we hope to be able to do that fairly soon.
Great. Okay, well, I think we managed to squeeze a lot in there in the last about 45 minutes or so. Really appreciate your patience. I know we got started a little late. We have a new platform we're using. Also appreciate the engagement and the questions being asked. A quick reminder before we let you go, there is a resource account listed here on the screen. If you have suggestions or requests for agenda topics for our next meeting, please send them to that resource account. And on that note, our next stakeholder webinar is scheduled for April 24th at 3 p.m. So we'll be sure to send a link out like we usually do through our listserv. If you think of agenda items in the meantime that you'd like us to address, please feel free to send to that resource account. Really appreciate you. Hope everyone has a great rest of your week, and we'll talk to you again soon.